Hello, this is my PowerPoint on comparing the VRAG-R and the HCR-20. Alright, so to start off with the origin of the VRAG-R, it stands for Violence Risk Appraisal Guide Revised. Previously it was just regular VRAG, but after the update, they added the revised part. It is an updated version. And it was updated on 2013 to increase the ease of scoring. 4 of the original VRAG items were dropped due to outdated criteria. It is used by criminal justice, forensic mental health settings. It was developed to predict recidivism in persons with a history of violence. The VRAG-R is made up of 12 total items. This actuarial risk assessment is used to assist in the prediction of future violent recidivism amongst male forensic psychiatry patients. The instrument utilizes the individual's clinical history to score rather than through interviews or questionnaires. The population, forensic psychiatrists use the VRAG-R to predict future violence risk amongst mentally disordered violent offenders. However, anyone can take the VRAG-R without a trained professional present. Alright, so the validity, this is a study. The first study is during 1994-1995. This was for the original VRAG, not the revised version. They use a sample size of 136 criminal offenders to test recidivism rates to the VRAG assessment, and it yielded a high predictive accuracy with 38% total convicts recidivizing. And then another study was done in, it was published in 2017, but it was assessed again, the VRAG-R this time, under a sample size of 120 criminal offenders. And it was measured as reliable and predictive validity, and this test was done after over 22 years. It was measured 22 years after the convict's release. The VRAG-R showed moderate levels of predictive validity that remained the same throughout the 22-year period. Alright, so the positives of the VRAG-R is that it is an actuarial assessment, and that's because the contact with an advisor, a professional clinical advisor, is not required for this assessment. It does not implement clinical opinion, and is purely statistical. Alright, and the transparency is a positive as well, because the VRAG-R's methodology is very straightforward and easy to comprehend. The consistency of the VRAG-R, standardized questions make the questions straightforward without having bias. The applicability of the VRAG-R is another positive because it can be used anywhere, any type of people. The negatives for the VRAG-R with that it is solely history dependent. The VRAG-R focuses only on the individual's past. It's purely statistical, as mentioned. This ignores any positive changes the individual may have received, such as current treatments, rehabilitations, religious interventions, or who knows, maybe they just turned a new leaf and they seriously changed, but the VRAG-R does not care about that because it is solely history based. The ethics are another negative, as unwarranted restrictions to an individual's liberties and stigmatization due to the risk of future recidivism may be seen as unfair, as it is the future crime, and future crime obviously has not happened yet. So should someone be restricted in their liberties or have stigmatization because of the fact that they're likely to recidivize when they haven't yet recidivized in the future, because we don't know about the future yet. And now lastly, the negative would be regional differences. Cultural differences may cause scoring on the VRAG-R to be unfair due to different perspectives, as different cultures may believe in different things. Alright, now moving on to the HCR-20. The origin it was published in 1995 and updated in 1997 to version 2, and currently we are on version 3. And it was developed over the past 5 years. HCR-20 is the world's most used, most validated, actually I don't know about most validated, it's most used and validated violence risk assessment instrument. It was translated into 20 different languages and developed into 35 total countries. It's used by mental health professionals and forensics practitioners when evaluating the recidivism risk of an adult individual with a history of violent acts. 20 risk factors it is made out of is 10 historical factors, 5 dynamic clinical factors, and 5 dynamic risk management factors. The evaluation of the HCR-20 is flexible to incorporate sensitive to personal and situational changes. Items are scored on a 3-point scale from the points being assigned as 0, 1, or 2, with high scores meaning more risk. Assists evaluators in constructing meaningful formulations of violence risk, future possibilities, appropriate risk management plans, and informative communications of risk. Alright, for the population, it is used by mental health professionals to determine treatment and strategies for mentally disordered, potential violent parolees, forensic mental health patients, and much more. The HCR-20 helps determine the possibility of future changes of violence amongst psychiatric patients. Now, using this information, the professionals using the HCR-20 could determine what to do with an offender and what kind of help they may require. As for the validity and reliability of the HCR-20, a test was done under a sample size of 80 total criminal offenders with the HCR-20 version 3. They were assessed for recidivism in violent behavior. Now a team of 4 independently assessed the HCR-20. The team interviewed and examined each case history of each convict. The results and predictions between the recidivism rates and the HCR-20 results correlated with each other, which indicated good validity. To further test the validity of the HCR-20, the independent teams analyzed the HCR-20 results with different tests, such as the Comprehensive Assessment of Psychopathic Personality Disorder Institute Rating Scale, the Pathology Checklist Revised, the PCR, the level of service inventory revised, and the Korean Offender Risk Assessment System general finding. And they found similar results. Now, the positives of the HCR-20 is that it is highly used around the globe. The HCR-20 is used by many countries. It has extensive research done to support its reliability. The framework of the HCR-20 is structured assessment that minimizes bias and maintains consistency. It's very flexible. Although it is structured, the HCR-20 uses trained professionals to get their judgment on each case as well. The applicability, the HCR-20 can work with different psychiatric diagnosis, criminal histories, demographics, and it's not limited to any offender type. The dynamic of the HCR-20 is a positive as it includes dynamic factors that can change scoring over time, and an assessment that might have been scored once can change. So someone from a high risk scoring could change to a medium or a low after case by case basis throughout time, if the offender has gotten help or has gone to rehabilitation or whatever. The HCR-20 also has negatives such as bias and mistakes. Because we are using trained assessors, it is possible that they could be inadequately trained. It may lead to incorrect decisions or scoring, and overall, because we are using human intervention, there is the possibility of human error or bias. Now, because training is required, unlike the VRAG-R, this assessment cannot be completed without a professional present. Now, the similarities between the VRAG-R and the HCR-20 is that both of them assess the chance of violent behavior in the future. Both assist in devising treatment plans, supervision, and release, and both assessments use a similar structure of grading benchmarks because it is, at the end of the day, while one does use numbers and the VRAG-R and HCR-20 also have differences. The VRAG-R is an actuarial assessment, meaning professional judgment is unnecessary to take the VRAG-R assessment, so it is completely statistical, and the HCR-20 is a structured professional judgment assessment. Therefore, it is a mix of clinical and actuarial. It does have statistical items, but the clinical opinion is also required for the HCR-20. Another difference is that the VRAG-R, as previously mentioned, cannot improve on its score. The VRAG-R is based on historical factors with questions asking about criminal history, family questions, age of first offense. Therefore, these things cannot be changed, while the HCR-20 can change its score due to the fact that it is a mix of historical, current, and future factors. Another difference is based on static factors, making it a very rigid system, while the HCR-20 is flexible, incorporating ongoing treatments and management into the assessment score. Lastly, the difference is that they are scored differently. The VRAG-R is scored from 0 to 40 total points. As you get higher points, it is seen as higher risk, while the HCR-20 is graded as a low risk, medium risk, or high risk. To conclude everything, both the VRAG-R and HCR-20 assessments focus on predicting future recidivism of violent behavior. The VRAG-R is based on a historical grading system that doesn't change over time, while the HCR-20 is based on dynamic assessment systems that grades previous, current, and the future. The HCR-20 score is meant to change over time as the individual gets better or worse. Now, both risk assessments do have their pros and cons, as previously mentioned. And that is it. Here are my references, and thank you very much.